Dr. Tao, thank you so much for doing this interview with us. I want to start with Germany. As you know, there are also a lot of cases in Germany, but we noticed that the fatality rate is rather low. Why do you think that's the case?
As of today, we are close to 44,000 confirmed cases, and we have 239 people that have perished. That is a case fatality of 0.5%. Italy, in contrast, has a death rate that is close to 10%. It is 20 times the German rate, right? Mostly, it has been argued that this is because Italy has a lot of old people, and oftentimes 3 generations live in the same house, so it gets spread quickly among the families. Then another argument has been that the air pollution levels in northern Italy are among the highest in Europe. And also it has been argued that very sick patients are the only ones that were actually tested and so on, right? So in my view, though, the most important reason for this huge discrepancy between Italy and Germany is that the Italian healthcare system collapsed very early into the crisis. They ran out of basic equipment such as masks and protective gear, and not to speak of the more complicated and sophisticated equipment that you would use for the ICU, like ventilators and so on. So the death rate skyrocketed in Italy because the healthcare system was overwhelmed. So another reason for why our death rate is still so low is that we tested early, and we tested a much broader population.
We know that in the United States, the situation is rather bad, especially in New York City and some other places. Do you think the United States will become the next Italy?
I think if you keep committing the same mistakes, the answer clearly is yes. One thing that we must learn quickly from Italy, for example, was that hospitals themselves are breeding grounds for the virus. You have to try to decentralize care and treat as many people with mobile units that you can, and also try to treat people in their homes while that is still possible. The Italian health system has collapsed because it was simply overwhelmed with new cases. So some hospitals were flooded with people, sometimes 60 to 80 people coming in one afternoon, and just overfilling the ICUs. And all these people were in critical condition and ready for intensive care. And then there were no equipment. There was no ventilators were available. And so they were really basically left to die. As I said before, the death rate, it skyrockets when the system is overrun and when the system collapses. So you must do everything in the US now to prevent your healthcare system from collapsing. That is very important.
I think the New York City is facing the situation that the medical system might be overrun by the patients. So what do you think the United States can learn from other countries such as China, South Korea, and Germany, and also Italy, right? Both lessons, I mean, the mistakes and best practices.
I really can't see what your strategy at the moment is. It just seems very patchy and inconsistent to me at the moment. So we know that it has been said that the cure cannot be worse than the problem, right? I'm afraid that with this coronavirus, this cure has to be. The problem is worse than it looks like. It's a wolf in a sheepskin, I would say. My suggestion would be you have to pull the emergency brake. Your train is racing towards a disaster, and I think for at least 2 to 3 weeks, normal life and activity has to come to a grinding halt in America in order to stop the virus from spreading, right? And then again, you need to test so much more testing needs to be done. You cannot fight an invisible enemy. If you are running low on testing kits, which I have read and heard, I would suggest that you do poll testing. So what I mean by that is if you would try to find representative populations and then just go out and poll test them, you would probably get a much more accurate picture of where you stand in this epidemic. Once you have tested these people positive, the most important issue is that you do contact tracing. That is, that you have to find those people and find all the people that have been in contact with them and then isolate them. That, you know, some people argue that you should isolate high-risk populations, the old and the chronically ill, but I would argue that that is probably too late by now. I mean, and also there are too many vulnerable people in the US society. I mean, we know that obesity is rampant. You have a lot of people with diabetes. These are two very important risk factors for COVID-19. You have people with uncontrolled high blood pressure and so on, which is another high risk factor. So you can't just isolate them from the rest of society. I mean, how would you do that, right?
So what kind of advice do you have for people like me who are, you know, right now living in the United States? For example, is it safe for us even to go outside your house to take a walk in the neighborhood while we are social distancing?
Yes. First of all, you need to educate yourself on hygiene. I don't want to repeat all that because people need to be educated on hygiene, and you educate yourself on the virus as much as you can. Then practice social distancing, which is really important. Here in Germany, outside of the home, families, no more than 2 people shall be together. That is the rule here, and it's become a law over this last week. So another thing is wear surgical masks if you have some. If you don't, just wear a scarf. The virus is transmitted by droplets. So if you are out in a shopping center, in a supermarket, just wear something to protect your nose and mouth. From an integrative medical point of view, I would suggest you to boost your immunity, and that you would do mostly by eating a very healthy diet, eat a lot of fruits and vegetables, avoid too much meat and sugars, and also very importantly, exercise for at least 2 hours a week. And in children, we say 1 hour of movement, free movement every day. And then another more and very important thing I would say is that you relax and try to stay level-headed. That's very important because stress is known to lower your immunity. On a social level, I think social isolation and a complete lockdown is the only way for the US to go now. And what I mean by that is social isolation and lockdown Wuhan style.
Dr. Tao, thank you so much for your time and for your advice.
Say if you want to prevent this pandemic from wrecking